pleasant day and a warm welcome to your favorite show, iMed. So this is a program where we discuss certain issues with regard to health, giving you advices to lead a successful life, maintain a proper well-being, and we were discussing about numerous disciplines, numerous diseases, health-related issues in our previous programs as well. Today also we are going to discuss a specific topic in this area, which is deafness, and to do the honors with us we invited Dr. Chandra Jayasinghe, consultant ENT. Madam, thank you very much for joining us with our program iMed. Madam, like today we are to discuss about deafness. So this is a widely discussed topic, and people first we must consider and we must give advice to the general public, because if someone is suffering from a hearing loss, we should not isolate them in the society. Madam, to give an exposure what deafness is.
Yeah, actually earlier also you asked whether we should use the term deafness or hearing loss. Anyone can hear one or two sounds. So a lot of people have hearing loss rather than deafness, but deafness is now how do we hear? We hear from the ear, and then the sound waves hit the eardrum, and the vibrations are carried to the middle ear and then the inner ear. After that, the brain will get the signal through the hearing nerve, or it's a cranial nerve, and then there's an area for hearing. Then after that, how do we talk? So we understand the speech and then we process it, and then we have to give the answer. So there are people like parrots, no? You have seen?
Yes,
so when you ask the word what's your name, they will repeat same thing. So that is not proper understanding. So if you can hear, your brain is normal, you will answer the question, what is your name? So I will say my name is Chandra Jayasuriya. But the other way, if I am like a parrot, I will say, what is your name? What is your name? So some autistic children, say there are people who have speech, but they don't have understanding. So that is another major issue.
That means it's understanding and hearing that you should contrast that thing. Madam, like to give an exposure, like this hearing impairment, like that is considered in different age levels. So can we discuss on that, madam?
So, and deafness, actually I forgot to tell you, deafness, there are various 3 to 4 levels, which may be mild, moderate, severe and profound. So mild and moderate deafness, a lot of people can manage with a hearing aid. Severe and profound, sometimes it's difficult with the hearing aid also, because why? You will be able to hear a sound, but you won't be able to understand a word. So the language is very complicated. You get phonetics, vowels, consonants. So you might hear some vowels but no consonant, then there is no speech, no meaning.
Yes,
so that is another issue. So deafness is very complicated that way. Sometimes you will hear sound, but all of us, what do we want to understand? We want to understand the words.
Yes.
So if I say amma, so if I don't hear consonants, ma only I hear. Not the middle part. But if we can lip read, we can understand. Now the problem is everyone is wearing a mask.
Yes.
So lip reading part is also affected. So that is why nowadays the society, this disability is worse because of the mask.
Right.
So now come back to the other question. So the different age groups have different causes for deafness. So it is actually the first sense to come in the intrauterine life. So before we see, we can smell, we can taste, we can hear in our mother's womb, and then it will remain there till you die. Until in your deathbed also you can hear. So babies can be born without hearing. So then that is a big issue, because we have all our education depend on this hearing ability and vision and hearing. So if a baby is born without these 2 senses, then they can't continue to have normal education and they can't become a normal individual. Sometimes they might learn with sign language, but we all can't speak with sign language, isn't it? So, so for that reason they will be disabled. So babies, when they are born with hearing loss, it's our duty to understand that this baby cannot hear before they start talking. Now at the first birthday, people know this Baba is not talking, and then they get alarmed. But we have wasted 1 year, because if we intervene at birth, then that baby can hear for 1 year, because the brain development depends on all our sensory organs. So if the baby cannot hear, that part of the brain does not develop. So baby will be retarded in spite of having normal brain at birth.
Right.
Baby will get retarded brain because the one sense organ is not working. So if we are intervening a baby, now in other developed countries they have neonatal screening. Neonatal, that means as soon as the baby is born, before baby is discharged, we test the hearing. In Sri Lanka also we have started that now. Castle Street Hospital, DMH, Anuradhapura, several hospitals, they have started.
Right.
So I think that is a very good move. We can diagnose babies' hearing loss before they start talking.
Is that the proper method to identify?
Yeah, that is the proper method. In all the other developed countries, they do it now. We are little late to start, but I am happy that we are on the correct path now.
So we should concentrate a lot on the babies, because like if the growth is retarded and if there is lacking that particular procedure and formal boost for them to grow, that will be a major issue with regard to babies. Right. Madam, when it comes to the other age group, because with this entertainment issue and the young people are exposed to this, because with your clinical exposure also you might having many experience.
Yeah. So young people, you know, everyone has a piece in the ear. You also have a piece in the ear, don't you?
Yes, for this program as well.
But even without program, you will be wearing a piece
Yes.
because you have a Bluetooth and then earbuds, various things you are using. So what will happen? Our ear is there to hear sounds for our survival actually. Now education came later, now when we are in the jungle. Why do you want to hear? Well, it's a survival thing.
Yes.
So if you will hear the danger signs and then you will act accordingly. So we are in the past, no one is hearing at this level, isn't it? So if you are hearing at the ear level, then you will damage the sound system, because there are very small sensitive hair cells in the ear. Small sensitive hair cells in the ear. So what will happen if there is a sound wave will damage the hair cells, so no longer hear. So these young children, young people, when they hear more than 1 hour at a stretch, very loud sounds, the hair cells will get damaged. The other one is if you are working in a noisy environment. Those people are young people, if they are working in a noisy environment. So if your decibel level, sound is measured in decibels, you may have heard of it. So if the decibel level is more than 85, that will damage your ear. So entertainment industry, it is far more than 85 decibels. But in my working environment also, if you are having loud environment in the workplace, you must wear the protection guard, you know, the ear muff, we call ear muff. You may have seen the people who shoot or pilots, these people wear. So you have to wear them to protect your ears. Unfortunately, a lot of people don't use them, even the employers give it to you. So that my advice is to have the minimum exposure to sound when you during the entertainment industry. If you want to listen music, keep your phone away and then listen. Then the sound waves are coming from far away. Why do you want to hear this level?
Might be like without disturbing the others, they need to entertain themselves. But it affects the health.
Yeah, because you are damaging your ear. So and then if you badly want to hear, then keep the volume low and reduce the one-time exposure to about 60 minutes or something. A small shorter duration of period you can. But some people, when they are studying also, they keep on listening to loud music. So we have seen young people are affected with hearing loss nowadays. So I forgot to tell you about the school going children.
Yes, madam.
School going children and toddlers and the preschool children, they can get affected with phlegm. When they have phlegm, they get their hearing loss. Why? Because the middle ear, you know, the middle ear is connected with the eustachian tube into the throat, the nose. So whenever you have noticed, when you get a cold, you feel ear is blocked, and then you do this, you do that, and then try to clear your ear. So the eustachian tube is connecting the middle ear and the nose. So if you have a cold, anyway you will have, you know, all the small children have recurrent cold. So they get phlegm problems, and then they can get phlegm in the middle ear also. Then this can affect their education. So if your child cannot hear, if you suspect, increase the volume of television, they speak loud, and their school performance can go down. Why the school performance? Because school performance, when our school performance is going down, any child, we must check the vision and hearing. Because children cannot say, I can't hear, I can't see. They can't understand. So in the school medical health time, they check the hearing and vision, but if you can miss it, and then that will affect their education. So hearing has to be checked in any child who is misbehaving. If you say that this child is not obedient and he is disturbing others in the class, maybe because the child cannot hear.
Right.
So we have to always check children who are mischievous for hearing and vision.
That means, madam, like if someone is suffering from this particular condition, they might not be able to identify, but the other elderly people, might be the teacher in the classroom or the parents, they must identify, because if they are misbehaving or they are not controllable to their words, they must consider. So in this specific area, I think it must be very clear for you all, as madam explained to you in the normal ordinary way, that everyone can understand. In this scenario, the other people, like close relatives, they must concentrate on this. Madam, when it comes to the next generation, that means the elderly people, we can talk about this as well.
Elderly people, I want to convey this message. Elderly people, all the elderly people will get affected with hearing. All the elderly people will get cataract and their vision will go down. Fortunately, you can do cataract surgery and then they can see very well. But the hearing thing, it's those fine hair cells, very tiny hair cells in the inner ear get damaged, and the nerve also can get degenerated. Even the brain can get degenerated. So these people, it happens gradually. The elderly people may not understand that they are having hearing loss, and then if you say so, they might lose their temper. I can hear, you are mad, I can hear that, like that they get they get annoyed when you say that I think your hearing is not okay. So unfortunately, when we don't correct this, what will happen? They can have a memory loss. Like they have found that Alzheimer's disease, one of the reasons is not correcting the hearing loss. So how do you know? When they are speaking little loud, they are isolated, they don't want to go anywhere, and then they ask to repeat, and then when they think other person is mumbling, they are not pronouncing words right, then you must understand this person is having a hearing loss. We can easily check hearing. There are two ways of checking hearing. One is with a machine, audiogram. Other one is we can whisper words 3 feet away. Then if you can, if I whisper from here and you can understand, but you will be blindfolded, you must turn away. So you turn the other way and then I whisper words. Then if you can repeat what I whisper, that means your hearing is clinically normal. So that is a simple way of testing. You can even check the individual ear by blocking the ear. There is a small piece inside in front of the ear. Can you see? This is called tragus. If you press this intermittently, if you press it intermittently, you can see your hearing is gone. Like this. So intermittent tragal pressure can block one side. So if I want to check your this side hearing, I can block this. I want to check your left ear. I will block your right ear with my this finger. Like this I will block, and then I ask you to turn the other way, and I will whisper 25. Repeat what I say. 25. 25.
25.
32.
32.
79.
79.
So your hearing this side is okay.
Right. Better with the earpiece also.
Right. So now like that, this is called a simple whispered voice test. So if you have loved ones at your home and if you want to check hearing without going to a person who is checking the hearing with a machine, audiogram, so this is also accepted way. Then if you think they cannot repeat, and then you can go to a person, then they need to go for hearing aids also. So you can see a ENT surgeon, because if you have wax, it is one of the commonest reason for deafness, wax, all over the world, any age group. So wax is very easy to identify with. When you instill a torch, you can see wax, but inner part of the ear, we can't see wax without a proper instrument, the otoscope. So when we identify wax, we can remove. Some people are very grateful when we remove wax. They say, now I can hear very well, because wax may be impacted and it is like a plug, completely blocking hearing. So one of the simple causes of hearing all over the world at any age group is wax. So if what you do, if you feel you have wax and blocked ear, you can instill some olive oil or glycerine and then go to the doctor. So you can save one appointment by instilling some wax solvent before you see the doctor.
Is it okay, madam, to have olive oil or any other thing?
No problem at all, because we also use olive oil. Commercial preparation, you need a prescription, but for olive oil, it is totally accepted, and then it works really well also, olive oil.
And madam, some people tend to insert some of those plugs and everything to remove. Sometimes it damages the ear, isn't it?
Yeah, and actually when you use cotton bud to remove wax, actually you don't remove wax, you push it further in. Because there is some wax, because ear has a mechanism of pushing the wax out on its own. So we are born with that mechanism. So if you don't disturb your ear, you will be without wax, because the wax is going to come out, and then when you have your shower, when you have your wash, it will come out. But nowadays what people are going against nature, they use various objects to push the wax in. So my experience is, people who get impacted wax are the people who are trying to remove wax. People who don't bother, they don't have wax problem.
That means, madam, people tend to clean the ear.
Yeah. This is a misconcept, no? You don't have to clean the ear. Ear is self-cleaning.
Right. If we are trying to clean that, it will burden us with like wax is going more further inside.
And then you get fungal infections also. Outer ear canal, if you try to clean, you will disturb the ear. Then you get fungal infection, you get wax impaction, you can get damage, because sometimes you can damage your eardrum also. Imagine I am using a cotton bud and doing that. Then you come and hit my elbow. What will happen? It will go pierce your eardrum and go into the middle ear, and then you will have a very clean deaf ear.
Yes, madam. And madam, like when it comes to those corrections, and madam, you might be having a good experience on this. Some people try to proceed with surgeries to correct. So what is the exposure with surgeries?
Yeah, that is also a good question. There are various operations at various ages, but if I tell you what are we going to do with a baby with a hearing loss, always we have to give a trial of hearing aid for 6 months. So you diagnose at birth. I tell you it can be diagnosed at birth.
Yes, we discussed.
So then we can give a hearing aid for 6 months, and then at 6 months of age, we know the baby is not very well responding to sound. Then we have to do some investigation, and we can go for a cochlear implant also. This done in Sri Lanka, but hearing aids is a must. Before we give the cochlear implant, we have to try with hearing aids. And the other surgeries are if the patient has a perforation in the drum. Then we can, patient has deafness if the eardrum is perforated. It's a very simple operation. We can correct the drum. Then the person will hear naturally. So we can correct. Other thing is, there are people sometimes have genetic problem. You know, there are 3 small bones inside the ear.
Yes.
3 small bones.
Yes.
So sometimes these bones are not vibrating well. With the sound wave, they should vibrate.
Yes.
They should dance with the sound wave. So if they are not dancing, then you don't get the energy transmitted to the inner ear and the brain. So what can you do? You can remove this bone which is not vibrating and put a new bone. So there are various operations at various levels you can do. Even elderly people, you can go for a cochlear implant. In developed countries, if they can afford to have money, even at 70 years, 75 years of age, we can offer, because when we don't correct hearing, we become isolated, don't we?
Yes, madam.
So we have to correct it.
It might be leading to a social problem as well.
Very well. As you mentioned, some people, they might say, I don't want to go out for dinner. I will stay at home. I don't want to go to temple or church. Why? Because when people talk, they can't answer the question. They just pretend to understand and give a wrong answer. Then other people get to know this person can't hear. So it is very important for the person to be socially active to correct hearing loss. And not only that, I told you the Alzheimer's also, the memory loss. So elderly people need hearing aid, small children need hearing aid as well as other surgery to correct. Young people, they have to understand this entertainment thing, recreation thing can damage their ear. And then the occupational, if they are working in because a lot of people, ladies working in garment factories, and then the tile cutters, even kottu, kottu makers,
yes,
you know,
that huge
very,
sound.
Yes, because that sound is very loud. So even a short exposure can damage your ears. So it is very important to know that you are your own protector of your ear, because you can protect your ear and the nerves if you are careful.
Right. Okay, madam, when something is like with a certain ailment, if a certain disease simply is left untreated, that might worsen. So if a certain consequence is there with a hearing impairment, if it's left untreated, what will happen? There might be many causative factors underlying, but simply can you explain what if it happens if left untreated?
If the infection is left untreated, infection can go to the brain. Why? You can see the ear is here, brain is here.
Yes.
It is separated by a very thin film of bone. It will be thickness of this paper even less than that.
Right.
So what will happen? The infection can spread to the brain. So maybe the price is very high if you get a brain infection. Sometimes you might die, or otherwise even if the doctors intervene, you might end up with epilepsy. So fits, various conditions.
Right.
So ear infection should not be left untreated because of the spread of disease into the various vital organs. So, and if you leave the deafness, the hearing impairment untreated, you will lose your ability to speech. So, you will become a dumb person.
Right.
Yeah. So, there is nothing called a dumb person. If you can hear, you will produce your speech. Right. So, it is very important to diagnose early to develop speech, and then if your other condition is now like if you have a fungal infection in the ear, how do you know there is a fungal infection? They are very common. I forgot to tell you, commonest problem in the ear we come across in the clinic is due to this cotton bud and various objects in the ear, they get outer ear canal infection. They don't cause deafness as such, but they can cause swelling of the ear canal. The sound waves can get hampered halfway. So my advice is not to clean the ear. If you feel you need to clean, we use a small piece of tissue actually. We can roll the tissue with the facial tissue. We can roll it and make a very small wick, and we can slowly dry mop the ear with that. That is the only thing I advise to clean the ear. Facial tissue rolled with your 2 fingers like a wick, and then you can without damaging your ear, you can clean
it. That is the proper way and the safest.
No feathers, no hair clips, no safety pins, no cotton buds, whatever a key, car key,
right.
Whatever you get, you pen.
Pen.
Then this pen is very good to stretch the ear.
Small pen. Small pen. Yes, madam. So we had an interactive session on deafness, and what we were discussing prior to this session also. Don't say that person is deaf. He has some hearing impairment. That's what madam said, like with this clinical exposure and advice in numerous patients and many high number also, madam, like there is a social impact also. So ladies and gentlemen, we were discussing about this deafness and hearing impairment, simply the consequences and how to manage that, even if it is a small child, the young people and the age related elderly people. We discussed a lot. So thank you very much, madam, Dr. Chandra Jayasuriya, for joining us with today's program, consultant ENT surgeon. Madam, thank you very much once again for joining with us. So stay tuned with iMed program, where we're discussing more new disease conditions, health related issues, giving you advices on numerous disciplines. Thank you very much. Stay tuned with iMed.